Hi everyone, I'm Erika del Sordo. Welcome to today's Talk with Erika, on location at one of my other favorite places here in Lake City, Allergy Specialty Care with Bill Sanders, PA. Welcome.
Thank you, Erika. I'm glad to be here. Glad you have me on today.
I'm glad I'm here. Thank you so much. Thank you. He was just showing me earlier some of his allergy minutes, and those are fantastic. I'm going to tell everyone later where they can find your stuff on Facebook, but let's talk about your beginnings, though. Talk to me about Allergy Specialty Care and how you started.
So no, I started doing allergy back in '93, and I was working with two talented women, Deanna Prescott and Denise Cohn, and we worked with different allergists in Gainesville during that time, and we had a satellite clinic in Lake City, and eventually, it's a long story, but back in 2000, we started this practice, and Deanna became the office manager, and Denise did the billing, and she currently lives in Jacksonville and does a lot of the billing remotely. And we've just built up a practice over time. And we've got a very talented staff now, professional staff, and we take care of allergies in like 5 counties. We're the only allergy clinic in Columbia counties. There's nobody in Suwannee, Hamilton, Union, Baker. We even take care of some of the people in Lafayette County and some of the other surrounding counties. But we handle pretty much all allergy complaints, and that's what we do.
I think that's fantastic. And that you actually have to see so many people in such an area because you're one of the only allergy specialists around. And as someone, we were talking earlier, back in 2008, I had allergy injections. So someone who suffers from allergies knows how important an office like yours is, and someone like you helping people overcome their allergies is. And so I really appreciate that.
And we have a lot of patients that come from Suwannee County, and so about 5 years ago we started traveling to Suwannee County on Tuesdays to Live Oak, and we actually give shots in Live Oak now. So
that's helpful.
So that way patients aren't driving, all the way to Lake City to get allergy shots, once a week. So it makes it more convenient for them.
That's wonderful. Yeah. So you have regular business hours, Monday through Friday.
Correct.
Okay.
We don't see patients on Thursdays. That's an administrative day to try to get caught up on everything. But yes, the other days we see patients.
That's wonderful. Yeah. So what are some of the worst allergies that you see up here in the North Florida area?
Well, the pollen is especially bad here. Patients have pollen allergies to trees, grass, and weeds. You may not know this, but most of the tree allergies, trees tend to pollinate in the spring, grasses in the summer, and weeds in the fall. There is quite a bit of overlap here in North Florida, but those pollens, those allergies are very prevalent. We also treat indoor allergens like animal danders, cat and dog specifically, and we also treat dust mite, house dust mites, and moles. So a lot of different allergens.
Super helpful, since pollen is a big one up here. Everyone take note. I usually know that my allergies are on point when everyone that lives around me has the same sneezing fits at the same time.
Yeah. Sneezing, nasal congestion, watery, itchy eyes, post-nasal drainage, runny nose. I mean, it can also affect people that have asthma. That can be a trigger for asthma. We have lots of asthmatics, and we specialize in asthma.
Hey, it's Bill Sanders with the Allergy Minute. Talking about asthma today. Asthma is a chronic, mostly reversible airway disease of the lung, characterized by coughing, shortness of breath, chest tightness, and wheezing. It can be mild or severe, even life-threatening sometimes. But like with all chronic diseases, asthma is not cured, but rather managed or controlled. Now, there are several causes or types of asthma, but the most common is allergic asthma. Another way to say this is that most all asthma has an allergic component to it. So controlling the allergies will go a long way in controlling the asthma.
We take care of other things besides your typical hay fever, asthma. We also take care of skin conditions like atopic dermatitis or eczema.
Eczema, right.
We take care of urticaria or hives. We see a ton of hives here. That's something, you know, a lot of doctors may not have time to treat, so we get a lot of referrals for hives. And, you know, we have good medicines for some of these things now. You know, some of these medicines called biologics, they can be quite expensive, but if you have insurance, and we can a lot of times get the insurance, get it approved for you to take them if your symptoms are severe.
Well, that's very good. Let me ask, what's the youngest age that you can see? How young can they be to get allergy injections?
Okay, so I've seen them really young before. I mean, I've seen infants at times, but we usually don't see them under 2. And really, for allergy injections, I would say, you know, if they're younger than 5 or 6, they probably don't need injections at that point. Maybe at rare occasions they might, but most kids, they haven't really been, when they're very young, like in the infant stage or toddler stage, they're not out in the elements as much, you know, being exposed to the different pollens. So they usually don't develop those allergens until later. Now they do get allergens to, the indoor allergens will tend to come up first, you know, like dust mites and animal danders. But, you know, studies have shown that kids that grow up with pets, they tend to do better now. So they tend to have less allergies. Some people think that they have non-allergenic pets, and there are some that are less allergenic than others, but a big thing is just the size of the pet. If you have a smaller pet, then there's going to be less surface area, just as if you have a short-haired pet, here again, it's less surface area.
This makes sense.
So less surface area to carry the dander, which is the little skin flakes, and also, you know, some dogs and cats will bring in pollen from the outside, and so if there's less surface areas, it's going to be less of a problem.
This is true. Do you have any other tips that you might want to share with viewers and listeners?
Well, okay, so the biggest, as far as treatment goes, we talk a lot about avoidance, you know, reducing your exposure to these things. If it's pollen, you can, when the pollen counts are really high, you can keep, you know, stay indoors, keep the windows closed. That'll help a lot.
AC.
If you've got to be out, yeah, definitely AC this time of year. If you've got to be outside, like say if you're working in the yard, you can wear masks. I mean, that's not going to completely eliminate the exposure, but it'll definitely cut down on the exposure. If it's a problem with indoor allergens like dust mites, I mean, dust mites are microscopic. You can't see these things, but they're going to be wherever humans are, like your bedding, your sofa, because they feed on human dander. You know, we have little skin flakes that fall off our bodies too, and that's what they feed on. And we breathe in their excrement and these little microscopic bodies. There's millions of them. Everybody's got them. Not everybody's allergic to them, but a lot of people are. And we just breathe in these things and we get sensitized. So mattress covers, pillow encasements, things like that, keeping the humidity down in the room, that can help. As far as pets, I have a lot of patients that sleep with their pets, and I know that's, in the old days we used to tell them, you know, to get rid of their pets, but they end up firing their allergists for that. So we quit telling them that. So, but I try to negotiate with my patients. If we can't get the pet out of the house, at least keep them out of your bedroom. If you can't keep them out of your bedroom, at least keep them out of your bed. I mean, I know some patients say want to use their cat as a pillow, and it can be a problem. But if you're really allergic, you can have somebody else wash your cat, somebody else in the family wash the cat, and then, you know, maybe wash your hands before you touch your face, because that can be a problem there. As far as molds, molds can be indoor or outdoor, and just keeping the humidity down. The more moist the air is, the more prevalent mold's going to be, and that can be a problem. But like any kind of damp areas in your house or outdoors, if you got piles of dead leaves, that can harbor mold. So just be on the lookout for that kind of stuff.
Okay.
Molds can actually be, there's different forms of molds, but if it's an allergenic mold, that's something we test for, but sometimes mold can be toxic, and they can produce microtoxins. And in those situations, you just have to get away from it. You have to ventilate the place and get away from it, because it can really be dangerous and cause problems down the road.
Right, absolutely.
Yeah, another thing that many people may not know that we take care of is we test and treat, we test for penicillin allergy. So penicillin, 10% of the population is labeled penicillin allergic. And it's the most common medication allergy out there. But interestingly, out of that 10%, that's a lot of people, very few of those people are actually allergic. It's less than 5%, probably more close to 2%. And so the reason for that is it's really two reasons. Either they were misdiagnosed to begin with, or they've outgrown it. They were misdiagnosed because maybe they were put on an antibiotic when they really had a virus, or maybe it was the virus itself that caused the rash, and they were on penicillin at the time, and they were told not to ever take penicillin. So if I had a nickel for every time somebody told me I had a rash when I was a baby and my mom told me never to take penicillin, I wouldn't have to work in allergy. But the other reason is that patients grow out of it. So if you've got a real penicillin allergy, like maybe you really did have an allergy, 50% of those patients will outgrow it in 5 years, and 80% will outgrow it in 10 years. There are some people that continue to have it, and definitely we would want those patients to avoid it. But patients, we actually test for penicillin allergy, and we do a skin test, and then as long as that's negative, then we give them penicillin, oral amoxicillin in the office, and we watch it for an hour. And you may still get a rash when you're taking penicillin, but what we're looking for is serious, what we call IgE-mediated reactions. In other words, once we determine you're negative for it, we're going to tell you that you're not going to have any serious reaction. You're not going to die from penicillin.
Right.
From our tests.
Okay.
Yeah.
Do you test for anything else that someone wouldn't think of?
Well,
everyone thinks of cats, dogs, mold.
Yeah, right.
We
also do another thing we do is patch testing. We for contact dermatitis. This is for things you come in contact with, maybe metals, like it might be jewelry, it might be makeup, maybe something you're using on your skin that you react to. Well, you may not know what the chemical is in that compound that's causing the problem, and that's what we could determine. And then once you know what the chemical is, you can read the labels and know what to avoid. So
I like that.
That can be helpful. Yeah.
That's very helpful. Absolutely.
Yeah. I really do love my job. I mean, I've been doing this for a long time, and I feel like we're successful here. We can really help people, and we just, if you've got a problem, we probably don't need to see if you just take a Zyrtec or a Claritin every now and then. But if you're taking antihistamines every day and you're still miserable, or even if you have to take it every day, you may want to get off of that. Then things like immunotherapy, allergy shots, or some tablets that are available that are for immunotherapy, we can desensitize you to these things and get you feeling better. And some people just don't realize that there's help out there, that they don't have to suffer. Yeah. Some people just think, this is the way it is. This is my life. I've got to have a stuffy nose and runny nose every day, and it's not true. That's not necessarily true. We can probably help you.
Thank you very much for being with me today. Thank you so much for watching. I cannot wait to do more, but you've really got a wonderful operation here that's going to help so many people suffering from allergies up here in North Florida.
Well, thank you, Erika. It was a pleasure to be here and talk about allergies. I love talking about allergies. It's what I do. I
love that. It's helpful for us who suffer from them. So thank you so much. And thank you for watching. Remember to subscribe. Have a great day.